The following portion of Live at 9 is sponsored by Stern Cardiovascular Center. This morning, we are speaking with one of their physicians, Dr. Ari Shakovsky. Thank you so much for joining us.
Thank you for having me.
Okay, so we're talking about the heart today. Tell us why it's important to know the difference between diastolic and systolic function.
The heart pushes blood out and the heart relaxes. Both of those functions could go wrong. When the heart can't push blood, we call it systolic heart failure. When the heart can't relax to let the blood in from the lungs, we call it diastolic heart failure or diastolic dysfunction. When somebody has heart failure, one of those things might be affected or both of them. It's important to know the difference because the treatment is different depending on the type of heart failure or dysfunction that you have. So ask your doctor, is my problem the squeeze or is my problem inability to relax normally or both?
Wow, what could happen to us if it's not functioning properly?
Well, we develop what's called congestive heart failure. The heart is unable to function normally. Either it can't provide the blood to the body as well as it should, or it may have trouble circulating the blood. And as a result of that, we develop congestion, a buildup of blood and fluid in our vascular space, the blood vessel of the circulatory system. And then a pressure buildup leads to fluid in the lungs, fluid in your legs, fluid in your belly, shortness of breath, fatigue. Organs can be affected. If the heart doesn't pump the blood well, it can affect your brain, it can affect your kidneys, and you can develop kidney failure. The liver can get congested. So the heart is basically the life pump of the body. And if the heart fails to do its job, then every part of our body suffers. So it's important, if you get a diagnosis of heart failure, besides knowing, well, what's the problem? What is the reason that I have this heart failure? Because there are multiple different types of heart failure. Seek the assistance of a cardiologist who can lay out the differences for you and provide you with the appropriate therapy depending on what your problem is and what created your heart failure. The second thing to know is not all cardiologists can handle all types of heart failure. Sometimes our heart failure gets so advanced, the regular cardiologist may not be able to assist you. That's when you need to seek help of an advanced heart failure specialist who has access to special medications, devices, pumps, and for some people who are very, very ill, transplantation and mechanical assist devices called left ventricular assist devices, but that can only be provided to you by an advanced heart failure specialist.
And what is the one key?
Is the only group that has heart failure specialists of that caliber.
And that's when you know that's when it's time to reach out.
That's right.
All right, thank you so much, Doctor, for being with us and explaining this to us to break it down so that we can get that help that we need. And the preceding portion of Live at 9 is sponsored by Stern Cardiovascular Center.
Stream Live at 9, live or on demand in the free WREG Plus app. Search your Roku, Fire, or Apple TV device for WREG Plus and look for this logo.